rise tonight to speak to the Health Statutes Amendment Act. No, I am not in support of this bill. I said earlier tonight I have a blanket no for everything. So yeah, no, don't like it, not a fan. Except for our amendments, I liked all of our amendments that we proposed tonight, but no for everything else. So, healthcare. I mean, wow, it's a big thing to talk about at 10:47. I'm doing it right now. You guys want to stay late. So, there's no doubt, Mr. Speaker, that our public healthcare system needs some support. And there's also no doubt that Albertans in the system, or who are trying to get into the system, also need some support. I believe that public health care is the greatest gift that we give each other. And at this time in history where we spend an awful lot of energy looking across the border, I'm increasingly thankful for our public health care system because I'm increasingly aware that they don't have that in the States, and that is one of the things that makes Canada so great, is that we have public health care. I know that everybody in this House appreciates a public health care system, even if we disagree on how to get there and how to manage it. This bill introduces significant changes to the Alberta health system, especially in regards to hospital administration and governance. So, for the past few months, the Minister has been conducting consultations across Alberta on these updates of separating the healthcare system into these 4 ministries and this division and this general restructuring or refocusing of healthcare. The legislative changes have been discussed, and I attended the public consultations in Canmore and Banff because I wanted to hear what people in my community had to say in these consultations. And so, I mean, I listened to people in my community. I know it's crazy. I went to these consultations as the MLA, and I participated, but mostly I listened. The people who attended these consultations were community residents, healthcare professionals, municipal leaders, small business owners. Some of them were people who had parents in care, or maybe they were in long-term care themselves, seniors in our community. The biggest questions that people in my community asked at these public health care consultations, the biggest question was why? Why are we separating healthcare into these 4 buckets, into these 4 ministries? Why now? And how will this choice make our healthcare system any better? The odd thing was, Mr. Speaker, was that there was no answers to those questions. And in fact, the public consultation wasn't even really allowed to discuss those questions because Albertans were never asked if they wanted the healthcare to be split into 4 buckets. They were just told that it's happening, and then the question was, how should we do it? But everybody was really largely confused as to why we're even having the conversation in the first place. I have yet to hear a reasonable justification from this minister of how separating our healthcare system into 4 buckets is going to make it better. How will this bring more doctors to my community in the Bow Valley of Canmore and Banff? How will it bring more doctors to Bragg Creek, to Redwood Meadows? I mean, people in Bragg Creek, you think it's close to the city. It's not. It's closer, but people in Bragg Creek don't want to drive to Calgary all the time. They want to see a doctor. They'd sure like to see a doctor in their own hamlet. So it's a little bit interesting that, you know, the minister has this traveling consultation roadshow. The consultation isn't really getting to the matter at hand that people want to discuss. When they try to ask questions about it, there aren't answers. And so basically it's a flawed consultation from the very beginning. And the results of that flawed consultation feed into this flawed Bill 55. So it's just flawed all over the place. This bill creates a new shared sector services agency, which I find this is really funny to me. So The bill creates a new shared sector services agency to manage human resources, information technology, and administrative functions across the healthcare system. So it's bringing the 4 buckets back together under one bucket called the Shared Sector Services Agency. Kind of sounds like what we have right now. So it really makes me feel like this is what a lot of bureaucracy looks like, Mr. Speaker. It looks like about 165 pages of a bill that is shuffling deck chairs on the Titanic and not actually addressing the concerns or the issues that Albertans have. We actually need to fix healthcare in meaningful ways, not just move things around and create a whole bunch of bureaucracy. Bureaucracy isn't more doctors in my community. It's not more nurses. It's not more anesthesiologists to make sure that every OR in the province is operating and actually conducting surgeries. It's just bureaucracy. I thought that everybody in this house hated big bureaucracy. I guess I was wrong. I guess that's just me.
I hate it.
Oh, you and my colleague on this side of the house. So the other thing that this bill does is it gets rid of hospital boards. I have to ask if hospital boards were consulted, and why are we getting rid of hospital boards? This was another thing that was not discussed at these consultations that I attended. Similarly, hospital governance overhaul in terms of the types of hospitals being consolidated under the term of approved hospital, that also was not discussed at these public consultations. So we've got these public consultations happening where the questions that people are asking aren't being answered, and some of the most significant changes to healthcare functionality is also not part of the consultation. So I have to ask, Mr. Speaker, what is the consultation for? It's just gathering a whole bunch of meaningless information that isn't actually being fed into bills at all. It's a little bit disappointing. So I don't really know why we're replacing hospital boards or how hospital boards were consulted, but I would really love some additional information from the minister in that regard. I'll tell you some things I have heard in my riding, Mr. Speaker, that is not included in this bill. I've kind of talked a little bit about the idea of needing more doctors. I think most communities around Alberta need more doctors. Part of the challenge for the Bow Valley is the cost of living, and it is one of the barriers to attracting new doctors and nurses into Canmore and Banff is the cost of housing, the cost of operating expenses for clinics, and how difficult it is for a doctor to be a business person and a doctor while trying to live in one of the most expensive communities in Alberta. This bill doesn't do anything to address housing or operating expenses for clinics or making life easier for doctors. Recently, I had an emergency doctor from my community come into my office. She also does work in Lake Louise. And she informed me that the clinic in Lake Louise, I mean, it's not a hospital, it's a doctor's clinic. 3 days a week, they used to do blood work, where they would draw the blood and then send it to Banff and send it off to Alberta Labs for analysis. That service of drawing blood 3 days a week in Lake Louise costs about $47,000 a year, and that service has been cut. So now, patients in Lake Louise who need to have their cholesterol tested or have any other kind of blood work done are told to drive to Banff to have their blood work done. Well, Banff is not Lake Louise, Mr. Speaker. Banff is, depending on the road conditions, at least half an hour, maybe 45 minutes, maybe an hour, maybe multiple hours if there's an accident on the Trans-Canada Highway, away from Lake Louise. So, right, it's like rural Alberta, they don't understand that small towns are actually far apart from each other. So people in Lake Louise who need to have blood work done now need to take a day off work. Well, a lot of people in Lake Louise don't have cars, so they have to take the bus, and the bus schedule doesn't work for them. They might have to take a whole day off work. That day off work is not subsidized or covered in any way. Basically, Mr. Speaker, what this means is that people in Lake Louise aren't getting their blood work done. it costs $47,000 a year. I really feel like we could probably fund that and make a pretty big difference in the lives of people with rural healthcare needs. Similarly, doctors on call in Lake Louise are paid $23 an hour to be on call every weekend. So they work during regular clinic hours, Monday to Friday, and then they're on call every weekend to get paid $23 an hour. If they see patients, they get a little bit more money for that work. But if they don't see patients, they're stuck in Lake Louise because they can't be out of cell service. Again, a very rural specific thing that once you leave town, you're not in cell coverage, and if you're on call, you have to be in cell coverage. So it basically means that our doctors in Lake Louise work 7 days a week and get paid very little money to do that, and they don't even get to enjoy the mountains that they live in because they have to stay in cell reception the whole time. I find those situations really disturbing and upsetting, Mr. Speaker, and this bill does nothing to address that. This bill is not going to improve rural health care. I know all members across the aisle are concerned about rural health care as well. This bill doesn't do anything for rural health care. And then that brings us to this whole idea of hospital operators and this ministerial oversight. I really cannot stress enough how uncomfortable I feel that every single UCP bill puts more powers in the hands of the minister that is proposing the bill. It is not cool, Mr. Speaker. I don't know another way to describe it because it's 10:58. But it's not cool, and I don't like it. I'm not a fan. You put more power in the hands of the minister changes. Every couple of years there could be a new minister on that file. So we put more hands in the power of the minister, and I think we just create uncertainty and inconsistency, and that is not what a robust healthcare system needs to serve Albertans, especially if somebody's on a wait list for a couple of years. They could be working under a different minister's direction by the time they actually get to have their knee surgery. This government has a problem with accountability when it comes to health care, and we've seen that through the corrupt care scandal. We've got allegations of favoring providers who are also donors and who happen to hang out at playoff hockey games and have great tickets and private jets. We've got questionable contracts with private surgical facilities, and yet this bill opens the door for private hospitals. I don't trust the UCP to manage private health care. I don't trust them to manage public health care. So I have a pretty big problem with this idea that the minister can designate hospital operators if they are deemed capable. What are the criteria for deeming an operator capable? What is this based on? Is there going to be an RFP that goes out that people or corporations can apply to run and own a hospital? This also speaks to the Premier's previous sentiment that competition fosters good care. It doesn't. Competition fosters profit-making, Mr. Speaker. It doesn't make better hospitals if companies or hospitals have to compete for an RFP to own a healthcare operation. But healthcare is not a business, it's a service. It's a service that we provide to Albertans, that it's how we take care of each other. This should not be in the minister's hands. I don't care who the minister is. I don't care if the minister is me. We should not leave the decision-making power of who deems a hospital acceptable. That should not be up to a minister. An approved hospital allows the minister to designate an operator or corporation if the minister deems them capable of delivery, appropriate with ministerial oversight, and considered recommendations by the provincial health agency. All of that is really subjective, Mr. Speaker. So it all raises questions, because what happened the last time this kind of stuff was up to the minister? We kind of saw how it turned out when the provincial health agency was allowed to enter into agreements with chartered surgical facilities. I don't want want to end up with a whole bunch of Moraige hospitals, Mr. Speaker. Thank you very much.